How is high white blood cells diagnosed?
Hello and welcome to today's video. In this episode, we will be discussing how a high white blood cell count is diagnosed. White blood cells, also known as leukocytes, are an essential part of our immune system. They help protect our body from infections and diseases. If there is an abnormal increase in the number of white blood cells, it can indicate an underlying health condition. Let's dive in and learn more about the diagnosis process.
Symptoms and medical history.
The first step in diagnosing a high white blood cell count is to evaluate the patient's symptoms and medical history. The doctor will ask questions about any ongoing symptoms, such as fever, fatigue, infections, or unusual bleeding. They will also inquire about any past medical conditions, medications, or recent surgeries. These details help the doctor understand the context and potential causes of the elevated white blood cell count.
Physical examination.
After gathering the necessary information, the doctor will perform a physical examination. During this examination, they will assess various aspects of the patient's health, including vital signs like temperature, heart rate, and blood pressure. The doctor will pay particular attention to signs of infection, inflammation, or any other physical abnormalities that may contribute to an increased white blood cell count.
Blood tests.
One of the most crucial steps in diagnosing a high white blood cell count is through blood tests. A complete blood count, CBC, is a common test that measures the various components of the blood, including red blood cells, white blood cells, and platelets. The CBC provides detailed information about the types and numbers of white blood cells present in the bloodstream. If the white blood cell count is high, further analysis may be necessary.
Differential blood count.
To identify the specific types of white blood cells that are elevated, a differential blood count is performed. This test analyzes the different types of white blood cells, such as neutrophils, lymphocytes, monocytes, eosinophils, and basophils. By examining the proportions of these different cell types, the doctor can gain insights into the underlying cause of the high white blood cell count. Certain conditions may cause an increase in a specific type of white blood cell, which can help guide further investigations.
Additional tests and examinations.
In some cases, additional tests and examinations may be necessary to determine the underlying cause of the elevated white blood cell count. These tests can include imaging studies like X-rays, ultrasounds, or CT scans to check for infections, tumors, or other abnormalities. Additionally, bone marrow aspiration and biopsy may be performed to evaluate the production and function of white blood cells in the bone marrow. In conclusion, diagnosing a high white blood cell count involves a comprehensive evaluation of symptoms, medical history, physical examination, and various blood tests. The results of these tests help determine the cause of the elevated white blood cell count, leading to appropriate treatment and management of the underlying condition. If you suspect you have a high white blood cell count or have any concerns about your health, it's important to consult with a healthcare professional. Remember, early detection and proper diagnosis are key to maintaining your well-being. Thank you for watching, and stay healthy.